Thanks for having us today. My name is Kathryn Asher and I'm the Associate Director of Strategy, Innovation and Planning at Sydney Kids. And Nicola and I are going to present to you today some work that we have been undertaking simultaneously with ARUP. And this is to establish the carbon footprint of our network and district, and also to establish a net zero pathway for both. I'd like to acknowledge the land that we're all joining on from today and always was and always will be Aboriginal land. So just to set the scene, the Sydney Children's Hospitals Network is the largest Australian paediatric healthcare provider to children across all of the state of New South Wales. And Northern Sydney Local Health District provides healthcare to almost 1 million people in the northern area of Sydney. I would like to acknowledge New South Wales Treasury, the Office of Energy and Climate Change, in particular Marine Asraf, whom commissioned ARUP, the consultancy group, to work with us on this project. I'd like to acknowledge Enrico Zara and his team from ARUP for partnering with us to allow this work to happen. So the slide that you have up there now is outlines the scope of the work that we undertook across both the district and the network. So this was very much an iterative process. As you would imagine, the complexity of footprinting an entire district and network. The greenhouse gas protocol was used for reporting on the greenhouse gas emissions. We used a baseline year of financial year 18 and 19 as a pre-COVID baseline, and both districts chose that year. Our emission boundaries, we included scope 1, 2, and 3 in our carbon footprinting and net zero pathway, and anything that was in operational control of both the network and the district. We used a number of sources to identify emission factors to enable us to calculate our carbon emissions. And where possible, we used Australian sources as well as some relevant research papers, and we used global sources where Australian weren't available. So on the screen now, you can see the range of emission sources that we included in our footprint. And you can imagine we engaged with a really significant number of data owners across the network and across the district. So where possible, we've used a bottom-up approach to establish our carbon footprint. You can see that for scope 1 and 2, we were able to achieve this with measured data. And for scope 3, we've used a combination of measured data estimates and also financial spend where we didn't have measured data available. You can see slight variations in the data availability in scope 3 between the two districts on the screen. So here is the greenhouse gas inventory for the financial year of 2018-19 for both Sydney Children's Hospital Network and Northern Sydney Local Health District. So you can see that Sydney Kids produced 92.7 kilotons of carbon dioxide equivalent, which is equal to around 14,000 round-the-world flights. Northern Sydney produced 177 kilotons of carbon dioxide equivalent, which is equivalent to around 25,000 round-the-world flights. We've also worked to quantify this by bed day, patient separation, and gross floor area. So this provides a bit more granularity on our footprint. So you can see the results show that energy used by buildings represents approximately 40% of the total for both services and highlights the significance of energy efficiency of the built environment and its importance in our decarbonisation strategy. The top 5 contributors for the network included electricity, pharmaceuticals, staff commuting, air travel, medical equipment. And for Northern Sydney, the top 5 were electricity, commissioned health services, staff commuting, medical equipment, and building energy from tenants. Here you can see further interrogation of this data, and this gives it relevance to healthcare by using the UK's NHS categories. You can see that delivery of care holds a significant piece of this pie along with supply chain. And interestingly for us, we found personal travel actually made up a significant portion, 16% at Sydney Children's Hospitals Network and 10% at Northern Sydney Local Health District. So here are just some graphics of the network's sustainability dashboard and the Northern Sydney's sustainability dashboard. So these are both being developed at the moment, and with the goal of being a dynamic dashboard to enable us to monitor key metrics, report on key metrics, and also track our progress so that we can use real-time data to inform some of the innovations that we need to make in this space. So that was a very quick snapshot of our footprint. I'm now going to hand over to Nicola, who's going to present on the pathway that was developed of the base of this work.
Thanks, Kath. So our net zero roadmap, once we'd completed our baseline carbon footprint, we worked with Arup on a roadmap for reducing our emissions and reaching net zero. These figures on this slide show our trajectories for scopes 1 to 3, with Northern Sydney on the left and Sydney Kids on the right there. So both trajectories have been developed to align to the Science Based Targets Initiative net zero standard, which is based on a no more than 1.5 degree warming scenario. For the emissions that we have direct control over, i.e. scopes 1 and 2, both Sydney Kids and Northern Sydney are aiming for a net zero by 2035 target with a 70 to 80% reduction by 2030. For the emissions that we have the ability to influence but do not have direct control over, i.e. scope 3, the Science Based Targets Initiative recommends a net zero by 2050 target. Based on that 1.5 degree warming scenario, this would see Northern Sydney achieve a 50% reduction in our Scope 3 emissions by 2035, which you can see by the light blue line. And for Sydney Kids, it's a 45% reduction, which is shown in the green line there. For both of us, these targets are a base, it's important to note, and not a ceiling, so will be regularly reviewed. Setting these targets was actually a really interesting part of the project, part of our journey for both of our organisations. They brought up really good discussions about balancing our motivation to act and the urgency to reduce emissions with the risk of greenwashing and reputational and financial risk as well. So both Cass and I found seeking this perspective of our staff and other agencies within New South Wales Health really valuable. And Sydney Kids had some great insights from their clinicians to inform the way their targets were set. For Scope 3 target in particular, it was helpful for us to be able to align with the Science Based Targets Initiative as an evidence-based model, as it accounts for that broader decarbonisation of the grid and supply chain that individual organisations are dependent on to achieve net zero without relying on offsets. So this figure shows Northern Sydney's trajectory in a bit more detail. The grey represents the estimated business as usual do nothing emissions trajectory that's expected to occur over the next 12 years from decarbonisation of the grid within Australia. And we've assumed the high grid decarbonisation scenario in our modelling to get us to net zero. The green area below that shows the total emissions reduction for Northern Sydney that is estimated we will achieve by 2035 based on the interventions that have been identified for us to implement over this time period. And then the blue, purple and red areas show the residual emissions that remain for scopes 1 to 3 by 2035. So the remaining scope 3 emissions will be reduced by 2050. And by 2035, we'll see a 3% residual emissions remaining for scopes 1 and 2 combined, which will require us to purchase offsets or purchase green power for those. And this is in line with the Science Based Targets Initiative, which only allows offsetting for up to 10% of total emissions. So how are we actually going to reduce our emissions? This is a short list of the emissions reduction interventions that Arup developed for us based on current evidence and interviews with our staff and other experts in New South Wales Health and Treasury. So these include interventions relating to sustainable models of care, which has been talked about already at the conference, reducing low value care, investing in primary prevention being really important. Energy efficiency, such as improving our energy management systems to better monitor energy usage and leakage, upgrading our buildings, which at Northern Sydney we have quite a few old and energy inefficient buildings, more LED lighting upgrades, better HVAC systems. Electrification, replacing gas-fired infrastructure at the end of life with electric and expanding our renewable and battery storage projects. Policy and procedure changes to reduce emissions in our supply chain. And I know Maddie touched on that as a big part of the picture. So engaging our top suppliers on how they can support us to get to net zero and collaborating across all of health. Sustainable travel, that came out as a really interesting one from our footprints. It was quite high. So promoting active travel to work, transitioning our fleet to EV and disincentivising business class air travel, increasing virtual care being some kind of easy wins there for us. Waste, improving staff education and behaviour related to waste, reducing single-use items, looking at supply take-back schemes, and food waste solutions for us as well. Medical gases has already been mentioned as well, the importance of we need to look at removing desflurane completely, reducing nitrous oxide use and leakage, and phasing out metered dose inhalers over the next number of years. Arup also calculated the capital and operational costs of these interventions for us, which helped with prioritising which interventions we should invest in based on the quantity of emissions they might reduce, which is also known as the marginal abatement cost or cost curve that they developed for us. That was really helpful as well. This figure just shows the pathway then that Arup have come up with for us for Scope 1 and 2 interventions, what this will look like over the next 12 years, and their individual implementation targets for each intervention. You can see the bulk of it all happening by 2030. And for Scope 3, similarly, this is the pathway of the interventions that we've prioritised as a district, and it's similar for Sydney Kids to get us to that 50% reduction by 2035, noting that these will then continue past that date into 2050 to get to net zero by 2050 for Scope 3. So there are a number of challenges and lessons that Kath and I learnt during this 9-month journey. One of the big ones was getting access to quality data, which was a challenge at the beginning. We've used mostly financial spend data, but there is opportunity for more bottom-up activity data to be looked at in the future. Working out how we report and track our emissions ongoing is a difficult one, and in terms of reporting our emissions, looking at how we categorise this, we had the opportunity to have that conversation with the Ministry and Treasury and collaborating across government to ensure there's consistency. Organisational readiness, we learnt that you need strong communication strategy with staff and executive sponsors, and setting up that governance early to ensure support for this kind of project is important. It being a whole of health challenge, I think that's reflected in what was being spoken at the conference today, but working with our counterparts at Ministry and the LHDs and also Maddie's team as well federally. And of course, setting targets. As I mentioned previously, ensuring that consultation and following an evidence-based approach is what we learnt from that challenge. Thanks, everybody, and there's our email addresses if you want to get in touch.